knock. Howdy, folks. Hello from Nashville. Welcome to the Dr. Ben and Friends podcast, the podcast dedicated to putting the med in comedy. We're shining a big, bright spotlight on everyday heroes of healthcare and comedy. We're here in Nashville. Our music city is rolling out the welcome mat, live tunes, live dancing, and hot punchlines. I'm your host, Dr. Ben, your friendly neighborhood board-certified orthopedic surgeon by day, stand-up comedian by night. Today, I'm trading bone saws for microphones, for a few hours anyway. Today, sitting next to me is professional comic Paula Kosienski.
Thank you for having me.
Thanks for being here. Her dry humor is more contagious than MRSA, MRSA. She delivers laughs hotter than a post-op fever, Nashville hot chicken style. We're glad Paula's here. And our real-life healthcare hero, Dr. Mike. Now, Dr. Mike's a dedicated emergency room physician and medical toxicologist. We're going to learn more about that. His dedication is stronger than titanium hardware. That's right. The Dr. Ben and Friends podcast prescribes 100% comedy with zero copay, folks. Today, we're celebrating the healthcare heroes and comics who dedicate themselves to making the world healthier and funnier along the way. Thank you both for joining us. All right, listener, grab your scrubs and your sense of humor.
Got it.
Check.
I left mine in the car.
A special thanks to our sponsor, The Needles Group in beautiful Marco Island, Florida. As a doctor, I know a great needle when I see one, and these realtors are the best in the business. Buying or selling, let The Needles Group inject some serious value into your property game, theneedlesgroup.com. All right, y'all, let's give it up for Miss Paula. Now, Miss Paula is a clean, deadpan comedian who's blossomed here in Nashville. She's originally from North Dakota. You may have seen her dry bar special. She's performed at Ryman Auditorium, been on a cruise ship with Nate Bargatze, Nateland Cruise. Her pauses are legendary. Straight out of Nashville's comedy scene, I feel like we scored front row tickets to her next set. Welcome, Miss Paula.
Thank you so much. I'm very excited to be here. I'm very excited to be here with the two doctors because it'll be nice to have another person that I can text pictures to.
Hey, what do you make of this? Some free curbside consults.
If it's not a broken bone, it's going to go to me.
All right. Now, Miss Paula, Dr. Mike here is a board-certified emergency medicine physician, doctor, and also a medical toxicologist. What do you think Dr. Mike does?
I think that he studies the one-hit Toxic by Britney Spears.
That's my pager ringtone.
Is it really?
Yeah. And his walk-up
No,
music.
but it should
you
be.
should make it
should be.
that.
That's
How can you be so toxic?
Yeah, exactly.
Just walking through the halls.
Consult.
All right. Can you think of any nicknames you might call Dr. Mike here?
I would say that to me, you are the toxic boy.
Oh, toxic boy.
Oh, man.
Sorry.
they're on there.
The toxic revenger.
How about the tox doc?
Tox doc.
Ooh,
Yeah.
I think that I would call him the detox detective.
Oh, I like it. You do have to be kind of like a detective at times at work, don't you?
Absolutely. That's the fun part about the job.
It's like House MD.
Yeah, that's what one of the spine surgeons calls me.
Do you have a cane?
Maybe.
He's always raising cane. He's always
Nice.
raising cane at work. All right, Dr. Mike, briefly, what exactly do you do?
Well, I wear many scrub caps, as I like to say. So I'm actually triple boarded in emergency medicine, medical toxicology, and addiction medicine. And for fun, I'm a medical review officer, so doing a lot of drug testing interpretation.
How does one become an emergency medicine doctor, a medical toxicologist, like as far as like training?
Yeah.
And then what attracted you to those areas of medicine?
So you have to go to regular medical school, do your 4 years there, and then you do an emergency medicine residency, which is either 3 or 4 years. And then from there, you do a 2-year medical toxicology fellowship. And then when I got out of that, the practice pathway for addiction medicine was still open. And since I was practicing addiction medicine already, I was able to petition the board and they allowed me to sit for the exam. So I got another credential without having to do the 1-year fellowship for addiction.
Oh, that's pretty cool.
Basically,
That's a lot of training. Why is it 3 or 4 years, the residency?
yeah, that's a great question. There's actually a discussion currently with the graduate medical education about making them all 4 years. Approximately 25% of the programs in
I
the
bet
country.
that's really going to be a popular decision.
Oh, yeah. No. I went to a 4-year program, so of course I did 6 years of training. I could have been a surgeon with all the time that I've done with a fellowship.
Yeah, because you do 4 years of undergrad to get a
Yeah.
bachelor's degree,
Yeah.
4 years of medical school,
Yeah.
and then 3 to 4 years of residency, and then extra training fellowship to be.
Yeah, it's a lot of time. And basically anything to do with drugs, overdoses, poisoning, withdrawals is my 2 fellowships. And then emergency medicine is jack of all trades, master of resuscitation.
Do you know how you would poison someone if you chose?
Oh, absolutely.
Can I tell you what I think I would do and you can give me advice?
Absolutely. Oh, I'd love that. Tell me.
Okay,
How would
I
you?
was told to stick someone with an air bubble in between their toes. So I was told you guys don't check there.
So you would need a pretty big air bolus to get an embolism from that. So that would be really hard to do.
Okay.
Between the toes.
Yeah, between the toes, probably not going to get it. You would have to do it in a line that was already there, and it's a lot of air in order to cause an air embolism.
Okay.
Listener,
so-
don't try this at home.
Yeah, don't recommend it. That's part of as Dr. Ben was saying, like some of what I do is a lot of detective work, right? Because there isn't like patients come in, I want to be tested for drugs. It's like, fantastic. Which ones? They're like, what? But I was poisoned. It's like, I need a little more information because there's not just like drug test.
It would be kind of funny to be like, you're like a victim of poisoning and they're like, what are you poisoned with? And you're like, I don't know. Why don't you ask the person that poisoned me? Like,
And there's probably a lot of true crime. Tell me if this is true. Like antifreeze, like could
Oh, absolutely.
oh my
because
gosh.
it's like tasteless, odorless.
Oh, no, it tastes
Some
good.
people-
No,
It
it
tastes good?
tastes sweet. Yeah.
Okay, I
I've
would
never
like
tasted
to.
it. Listener, don't taste it.
Yeah, don't taste it. That's why dogs get sick from it a lot because it tastes sweet and so they eat it. Yeah, no, antifreeze tastes good.
Okay, I have a question about that. So there's a Dateline episode that I watched that they put antifreeze in yellow Gatorade because it's yellow.
It can be. It depends on the brand.
It can be, and that's how it went down. And ever since then, but what I heard, you should tell me if this is true, is it causes excessive thirst. So for literally my entire life since that episode, whenever I've been offered Gatorade, I drink a small part of it and then I set my timer for 15 minutes. And if I experience thirst, I don't drink the rest of it, which is pretty, I think, ironic because if you're drinking Gatorade, you're probably pretty thirsty. Is that true?
And don't drink an unopened Gatorade that someone gives you, probably. Make sure it's
Yeah, well, I mean, I was
brand new.
doing it like from my mom, like nobody's
Trust
safe.
no one.
Yeah.
Trust no one.
But is that true? Does it cause excessive thirst?
Not necessarily.
Oh, this
No.
is just getting
And
hard.
how
I
does
know.
antifreeze kill somebody?
It's primarily through the kidney. So it's ethylene glycol is the antifreeze, and the toxic metabolite is actually what kills you. It's not the parent compound. And so it gets converted into an acid and then causes crystallization, crystal formation in the kidneys. So you die of renal failure.
Wow.
That's mostly what it is. And then
Like-
metabolic acidosis. So lots of things in
And that
tox.
would be determined on like autopsy or something? Or
No,
Okay.
I can.
Okay.
So we can get levels. That's one of the few things we can get levels for, but they take a little bit of time depending on the lab. If it'll come back right away. And the traditional teaching is to actually do for something called an osmolar gap, and you do the calculated versus the expected, and it depends on the story, and then you treat empirically. So I can give them the antidote, which does not allow the parent compound to be converted into the toxic metabolite, and they'll pee it off. So I can continuously block somebody every 12 hours, and if they're not acidotic, if their blood isn't acid, then I can reverse them without usually dialyzing them.
What kind of symptoms would a person that's being poisoned with antifreeze have?
Let me get
how
my
would they
notebook.
Some urinary symptoms or something?
Some urinary symptoms sometimes, but they're just overall not feeling well
Okay.
because they're becoming acidotic. So,
Okay.
so like
Probably don't feel good when you're being
No.
poisoned to death.
it's pretty awful. And they can have altered mental status, and they can have difficulty with their breathing, and it
Okay.
affects their entire metabolism. It's pretty rough.
So, like in that situation, what's the percent chance that you catch this before like, let's say this person wasn't told in advance that they were going to be poisoned, so they don't know.
Well, which is hopefully most. If you're the poisoner, you shouldn't
people
tell
are
them.
crazy. They'll do wild things. But like, how quick? Like, what's the percent that you catch it before it's too late?
Becomes.
So what you're looking for, it really depends on the story. It's like, I'm suddenly very ill. It's like, oh, I went out to a party. Okay, well, I can check that the serum osms, and I'm going to get the rest of the blood work, and I look at their kidney function. I'm like, something's going on here. And so it's a cause of what's called a high anion gap metabolic acidosis. If you look at the differential for that, like, more than half of it is tox causes. So then I get a phone call like, hey, could this be? I'm like, could be. So let's send the test. Let's treat them. I'll get it taken care of. So they call me and I come in and save the day and tell them what to do.
It's pretty cool.
But it's the bat signal.
Have you ever had a situation where someone comes in and then to be fair, poisoning is like more of a girl's thing.
You'd be surprised.
In the crime world, but killing your spouse is more of a guy thing. So whatever. But do you ever meet a couple and you're like, I'm pretty sure that guy's trying to kill that girl?
I have not, but I've had a mentor that had that case, and it's in his actual memoir book in New Jersey.
Wow.
Yeah, it's something that you could do a movie out of. She was actively poisoning him while still in the hospital, feeding him every day, feeding him poison as he was getting sicker and sicker.
Episode.
With antifreeze or another poison?
This was a different poison.
Oh,
well, yeah, it was. It was pretty rough. But he was the state toxicologist driving in a blizzard, going down to try to save this person,
Wow.
and got the antidote out of the chemistry lab because it's used as the stain. So he got it from the so that was the antidote for the poison. It's a stain that's used and it can bind it up.
Wow.
And so the person died, and so he could talk about it now because the court case is over.
Wow. Do we still see arsenic or cyanide poisonings?
Oh, cyanide I see a lot actually. Yeah,
Okay.
it's common in fires.
Oh, okay. Is that the most common way to get cyanide
That's
poisoning?
the more common way of getting cyanide poisoning.
So there's a fire that starts and then you're in the fire and then you breathe it?
Yeah, exactly. It's the furniture.
Inhalation.
Yeah, it's inhalation. So you can get carbon monoxide and you can get cyanide, and it can be a little sometimes tricky to tell them apart because there's so many things. It's in environmental stuff, it's almost never just one thing. And that's part of the fun part about my job is most people can handle one thing. It's when you have, I took a bunch of this pill, I took a bunch of this pill, and then it all mixes together in the body, and I have to kind of tease out what effect is coming from which and which is the best way to manage it. That's the fun part about being a toxicologist.
Do you want to hear a funny story about something that I did when I thought I was going to poison? I thought I poisoned myself.
Ooh.
Yes.
I took a bunch of Miralax and I took some Sudafed and I thought that they would react poorly together. And I went to the emergency room and they were like, go home. You're fine. This is two very normal medications.
Well, I mean, in too much, they can, too much Sudafed can give you some negative side effects. Probably not going to kill you, but yeah. Oh, one of the things that we do in terms of detoxifying patients is something called whole bowel irrigation. And
Tell us more about that.
Oh, it's exactly what it sounds like. So it's a very bad day for your nurses. What you do is you put the order and then you go up to your nurse and say, I'm sorry, here's a cookie because I just ruined your shift.
Here's a cookie that you will not be able to keep down.
So you have to do literally colonic cleansing. You need to flush it all out.
Yep. And you're just trying to flush everything out because you give it early enough. If it's going to be a bad overdose, that could potentially kill somebody. If it's still in their stomach or the first part of their intestine within the first hour or two, I can order that and you basically make them drink or put a nasogastric tube in. So a tube that goes in their nose.
I've had those.
Oh, they're awful. And then force Go Lightly, the colon prep. And then sometimes what I'll do is I'll do Go Lightly with a charcoal chaser. So activated charcoal is what we'll use to bind up some toxins. And so how do you know when you're done? The traditional teaching is when the effluent is clear, or when I see the charcoal come out. So
he's like a mixologist, a bartender. I got a charcoal chaser.
It's a charcoal chaser. Yeah, exactly. I mean, it's toxic alcohols and regular alcohols. That's one of my hobbies is regular alcohols, just to collect them. I barely drink these days, but I like the taste. We're just tasting, okay?
Just the taste. But similar, if you have a colonoscopy, the prep you have to do. Listener, you may have had a colonoscopy. That prep is probably miserable.
Oh, it's miserable.
So I'm a little confused because the Go Lightly makes me feel like it's going out one way.
Correct.
But then the charcoal makes me think it's going out the other way.
So it shouldn't. If you're vomiting charcoal, that's a bad day because if it gets into your lungs, that can be very, very bad. So you want everything to go out the back end. And
Out the back
so,
door.
yeah, you wanted to go out the back door nice and dark, hopefully bound up most of the stuff.
Gotcha. So you shouldn't be throwing up.
Please don't. Yeah, that's not good. We try not to do anything out the top anymore. We try to either push it out
So it
or
doesn't go
bind
into
it
your
up.
lungs.
Exactly.
Right.
Yeah.
And I have a feeling like if you throw up poison,
Mhm.
it goes out like your throat. It probably makes it
Irritated.
sore. Yeah.
Well, that's the old way of doing it. And in certain areas where there's just not a lot of healthcare, we still will use syrup of Ipecac.
Mhm.
It was taken off the ambulances more than 2 decades ago in most places. And that's the way that we used to treat poisonings is you make people vomit it out, right?
Mhm.
We don't do that anymore. We have medication we can push it through so that it doesn't get absorbed and you're not running that risk, especially if
Nice.
it's like an acid or a base where it can get into your esophagus and cause damage or potentially, sometimes these medications make you sleepy and then you vomit and then you aspirate that and then you get into the lung. It's a bad day.
Well, I just gotta say, I've had to try the Go Lightly before, and if somebody was like, "It's this or poison," I would be like, "Let's try the poison,"
yeah,
because
That's how.
that stuff's not great.
No, there's nothing light about Go Lightly.
Yeah.
There's nothing
It's a
light about it.
misnomer.
It's a
Yeah.
misnomer. It's
False
like,
advertising.
yeah, it's just a little pinch. It's just a little prick. You're going to be a little sore afterwards. No,
Right.
no.
Go heavy.
Just the taste, you're like, this is poison.
They should
Like,
make it more
medicine.
palatable.
yeah, they should
Make it
just.
taste more like antifreeze.
Well, there's sorbitol. So there are sorbitol ones. Like when I give activated charcoal the first round, I'll give it with sorbitol which will make it sweeter. So I'll do that the first time, and then additional doses. I don't use sorbitol because it'll give people the runs. So it
Oh,
may
yeah,
not be
well,
necessary.
Isn't that kind of what we're trying to do here?
Well, in this case, we are, but not every patient needs to have that discomfort.
Gotcha. Okay. Crazy.
All right, folks. Thank you, team. Now it's time for Common Sense Healthcare ads. This episode of the Dr. Ben and Friends podcast is brought to you by Toe Jam. Nail fungus, or as Dr. Mike would call it, onychomycosis. Try Toe Jam. Smear mango preserves between your toes and wrap in plastic overnight. The fruit enzymes eat the fungus alive. Dr. Mike, he's a fun guy. Wake up to sweet, smelly victory or fruit flies. Delicious results guaranteed. Make sure to use Dr. Ben at checkout for 25% off your Toe Jam. You're also emergency medicine physician. Can you kind of paint a picture for like a typical day in the life? Is it like The Pit? Is it?
It can be. It actually, I actually quite appreciate that show because it can give a representative day. And I've had days at the hospitals I've worked at that are very similar to that. We can, there's a lot of things. We get everything. So chest pain, shortness of breath, headaches, belly pain. My toe's been hurting me for 6 months.
Right.
Or
I'll
my,
go to the
And
emergency
I
room.
chose to go in at Friday at 9 p.m.
Yes.
it's quite, yeah. Or it's like my shoulder hurts. Like, where'd you get your surgery done? Oh, I got it done at this hospital. You do realize we're not in that system and that your surgeon's not here, right? Get a lot of those.
So you'll come in like maybe 7 in the morning or 7 at night or.
Oh, me? Yeah, I'm a 6.
There's different shifts.
Yeah, there's different shifts, and it really depends. And Mondays are the worst. It's like a Garfield thing. I hate Mondays.
Really?
So yeah, because people don't want to come in on the weekend, and they're enjoying their weekend. And like, oh, I'll get it taken care of on Monday. So they
Yeah,
come
they don't want to ruin their
They
weekend.
don't want to
by-
ruin their
Yeah.
weekend for their emergent
Emergent.
complaints. No, if it's actually emergent, of course we're going to take care of you very quickly. But
Yeah.
there's things called triage where we see, how serious is this, and unfortunately, sometimes you're going to have to wait for somebody that's sicker. But Mondays, if you can avoid the ER on Mondays, we would appreciate that.
Do you do the triage or?
The nurses do the triage.
Okay, nurse will
Yeah,
triage.
nurse will triage.
Do you know what that is, triage?
I know what triage is. It's where you look at all the patients and you go, you are less important and you are more important.
It's not important. It's you're less dire.
You're less valuable.
No,
not even that.
Not even that. No. Every life is valuable. It's just certain complaints need to be addressed more quickly than others.
Right.
It's
You
French.
could die of chest pain, but you're not going to die of a toe that hurt for 6 months.
Yeah, unless it's osteo.
Gangrenous and you're getting toxic.
Me, yes.
Have you ever had to do have you ever been on the stand before, like been called as an expert witness?
Oh yeah, absolutely.
Tell me about it.
I can give you some vague details. I can't talk about specific
Right, yeah,
cases,
don't-
but I've done some cases. Most of them are family law related these days.
Oh, that's upsetting.
Well, I mean, it's all
Like a spouse trying to kill somebody?
Oh, I wish.
Oh.
No, I hope I don't want anybody killing anybody, but
Keep that part.
no. It's mostly like, is this person fit to take care of another person based on their drug testing? Or was somebody intoxicated at the time of an injury, accident, etc. So I'll do some defense cases, calculate what their alcohol level may or may not have been within a certain range at the time of an incident. And
Does that make you nervous being deposed?
not when I'm the
you have to-
expert. Not when
You
I'm
have
the
to
expert.
swear in?
Oh yeah, I know you swear in, but it's actually
Always
quite.
tell the truth.
Oh, absolutely, nothing but the truth.
Okay.
Oh, it's really.
So help me God.
Yeah.
Could we swear him in for our podcast? Please raise your right hand.
Raise a hand, but do you have a siddur? A siddur? I don't use the Bible.
Do you okay, did you pay attention to the Kieran Reed case?
I don't know who that is.
Oh, you're missing out. This is right up your wheelhouse. It was like
Give us a synopsis.
okay, I will. So you guys probably know it. She was accused of purposely backing over her boyfriend.
Mhm.
But if you have two brain cells that you rub together, that's not what happened. The trial, she got convicted or not guilty. She got convicted of
She's
not
found
guilty.
found not guilty.
She
of-
was found not guilty. But the reason that I bring it up for you is because she was like most definitely drunk
Mhm.
while driving. And so like the question was like, was she so drunk that she maybe hit him and didn't know?
Mhm.
Which is also no, she didn't hit him. No collision. But anyway, I just wasn't sure if you take your work home with you.
Oh, I try not to do that. Take my
like a
homework.
negligent
Well,
homicide.
But in these kind of cases, there's two opinions here, right? There's the legal definition of intoxicated and there's the clinical definition of intoxicated. And I get to opine on both, which is really fun as the
So what's
expert.
the difference?
Well, illegal intoxication is over a
Lab
state
value.
Yeah,
Yeah.
it's called a per se limit,
Mhm.
which is the 0.08 from a
Mhm.
whole blood. So I have to do calculations when I get hospital labs because that's not whole blood. And then there's the clinical intoxication when you're like, oh, I'm drunk. And then otherwise we're having a normal conversation like this, but there may be alcohol involved.
So you would say like,
Which there isn't, but could be.
No, that's just
speak
water.
for yourself.
It's fun. It's a lot of detective work. And that's why I do it because at the end of the day, I emergency medicine is nights, weekends, holidays, flipping, flopping here, going to different places. And it can burn you out. And so having this other related career that is very cerebral, it really does help with my longevity.
Did that ever make you want to go into law? Having those depositions, it's kind of, they speak with their own language. Medical medicine has theirs and law has theirs. And I'll watch like Suits and be like, man, that law looks like fun.
You know, it's actually really fun being the expert. I don't want to be dealing with writing briefs and things like that, but you have to write opinions. And so you get a little bit of that. It's like writing like an essay for college again, because you have to like cite sources and things like that. But I like what I do, part of it, because I get to be part of the team and part of the the thought process. And because you have one piece of this case, they're looking at it from a 10,000 or 20,000 point view, and I have my little piece. So you get to play around a little bit and be part of that and understand the strategy.
Do you play more for the defense or the offense?
I usually do more defense.
Okay,
From the med legal stuff.
Yeah, because they're like, my girl's not drunk. This guy will tell you, and then you go up and you go, she's fine.
Well, I don't say it like that. I need some evidence. I can't just say like, yeah, they're not drunk. It's like, okay, well, what's the evidence? I didn't see them.
Dr. Mike, what are some of the more common toxicities and poisonings that you encounter and see both in the ER and as a medical toxicologist?
Oh, yeah. Most commonly, it's Tylenol.
Tylenol. Okay.
No
and,
way.
yeah, Tylenol is one of the biggest because it's in everything. And the joke that we have,
Both intentional and unintentional.
yeah, exactly, because it's easy to get, and and it's pretty easy to overdose on. And it's the funniest thing is when we go to our national tox conferences, we're still talking about Tylenol management.
And how does that patient present?
That's a delayed toxicity, which is why it's so dangerous, right?
Okay.
That's why we
Tell us
check.
about
That's
that.
why we check for it. So it's mostly a liver toxin, but it can affect the
Right.
kidneys, and so it can cause obviously liver failure and then kidney failure. And then when your liver fails, then you start to puff up because you you get edematous, and then your brain can swell, and
Mhm.
the way you
Turn yellow.
turn yellow. That's right. So there is an antidote, and we can give that through the IV, or we can give it orally. But
Would it be fun if the antidote was just ibuprofen? That'd be pretty fun.
That's a different toxicity. That causes renal failure. That one's a little harder to overdose on in terms of like the milligrams per kilogram that you would need.
That's actually really good news because Tylenol never works. I feel like Tylenol is just one big joke and it's like a placebo and it's just nothing in there helpful.
Now, can you say what the generic term, the name is?
Yeah, acetaminophen.
Wow.
Well done.
Dr. Paula.
Well done.
I have my way around some ibuprofen and acetaminophen.
Acetaminophen.
What's second on the list of
Well,
for
alcohol.
common
Alcohol.
I
get a lot
Tylenol,
of
alcohol.
That one's more
Tylenol.
fun.
Yeah, that one's more fun, but it's like you can get an alcoholic, ketoacidosis. And so is it actually a toxic alcohol or regular alcohol? A lot of patients will come in on their overdose on their psych medications. So we'll get benzos, we'll get their antidepressants, we'll get their antipsychotics. Those are fairly common. Then we'll get the environmental exposure. So I'm the guy that takes care of snake bites. So we're going to have snake bite season soon. So I get all the.
Tell us about that.
Oh, those we get a lot of them at one of the hospitals you and I both work at. They get transferred in to go see a hand surgeon.
Is it true that you have to like
Suck the
bring
poison out?
this? Well, that too, but like Nate Bargatze has a joke about how then you have to like bring him the snake.
Please don't bring me this snake.
He's like, you gotta catch this snake and so what do you do?
So if you've been bitten by a snake, do not try to suck out the poison. It's already around. You're going to put your dirty mouth on an open wound.
Okay.
Yeah. So you're going to potentially infect a wound, which please don't do that.
Okay. Listener, do not suck the poison out.
Do not suck the poison out. I know that's what they say on Archer. I've seen that episode of Archer. He's like, don't do that.
I think
Please
we've
don't
all
do
seen that.
Please don't do that. A constriction band, if there's going to be a delay in care, do not put a tourniquet on, but a constriction band.
Okay, tell us.
So
Tell the listener how to do a constriction band.
a constriction band would be, if you have like, a hair tie or something like that, something that type, but not a true tourniquet.
Because
Okay.
a tourniquet will cut off all blood flow.
Correct.
And you don't want all blood flow. You just don't
You'll get
want
a-
the
Did you go to
poison
medical
spread.
school? You're amazing.
A dead limb. You'll get an ischemic limb
I have a
after.
lot of problems.
An
Okay.
educated consumer over here.
So constriction.
A
but not
constriction band,
tourniquet.
if you're gonna have a delay, this is if you're bitten and you're an hour away from your closest medical facility. Go to the medical facility, try to snap a picture of the snake. Just yes, no,
Like a
no.
selfie? Get a selfie with
I
it?
wouldn't
or
probably get a selfie with it. I wouldn't probably get a selfie.
use a
with it.
selfie stick.
Exactly, selfie stick. Just try to get a picture of it. This way we know what it is.
Right.
To know what we're dealing with. But please do not bring a live snake to the emergency room. That has happened to me.
Oh, really?
They've brought
Is
it
this
in
still
a
poisonous?
bucket. Yeah, they've done that. I'm like, oh God, no. They're like, do you want to see it? No, I do not want to see the snake. Please
my
don't bring
God.
that in my emergency room. This was when I was a fellow in California. So they would bring in the Western Diamondbacks. It's like, no, I know what it is. Just take a picture.
I know what it is.
What are you bringing me the snake for?
Do not bring in the snake,
You're like,
listener.
this is like the one harmful snake in this area. I know what this is.
Yeah, please don't do that. And so I'll get blood work, and we'll then if it looks like what's called a wet bite, so a venomous bite, poisonous. Poison is something that you ingest. Venom is it's injected into you.
Yeah.
There's the difference.
See, I thought poisonous was like something that. So like my sister's like all into amphibians or whatever, and poison is something that is like a touch versus like I thought venom was something that was like
Injected into
yeah. Okay, I guess that makes
Venom is something that's put into you by,
Mhm.
and poison is something that you put in you,
Like
or that
ingest
it's ingested.
versense-
Versus
injected, like a
Right.
snake will inject
Right,
venom
so-
into you.
like if I touch a poisonous frog, it goes through my skin.
Mhm.
Is that considered ingested?
Well, because it's not injected into you. It's not like they're trying to get you. You're doing it to them.
Right. Okay, so it's like a consent thing.
Yeah, it's a consent thing. Don't touch the
Sorry.
don't touch the don't lick toads.
Don't like,
So,
especially
no,
poison.
Alright, I'll stop.
people will do that, right? There's some psychedelic toads, and they'll get confused for the cane toad, and that's actually it's a digoxin-like toxicity, so it's a heart toxicity.
Oh.
Yeah, don't lick toads. Just don't lick toads. It just makes if one thing
Are
is
those in-
If you're licking toads, maybe just switch to like meth or something.
please
like,
don't use meth. I do.
Or they'll do that. That's a whole nother
That's my
conversation.
third.
Yeah.
That's my third job.
That's
Is meth.
number 3.
That's my third job. That's the addiction. So you were asking about what other things that I see. So we can do the snake bites. We'll do some spider stuff.
What about a brown recluse?
So brown recluses, we see them quite commonly here.
And they don't kill you all the time.
No, not usually, but it can be a prolonged healing process because, again, it's an envenomation and it causes ulceration. Now,
And it happens all the time.
They don't want to...
An infection?
Not usually infection, but it might need debridement because it'll eschar.
Okay.
And so you might need to have a surgeon debride it and then maybe need to get a skin graft depending on the size of it.
What would be a deadly spider bite that you see?
Not many here.
Thank God.
Not
oh my
here.
God, thank God.
We're not in Australia.
But in Australia?
Oh yeah. So I had an attending back in Philadelphia when I was a resident. His name's Steve Walsh, and he's Walsh's rules of toxicology. Rule number 1: don't mess with the KGB. Okay, that's rule number 1. Don't mess with the KGB.
Listen, good advice.
Yeah. Rule number 2: everything in Australia is trying to kill you.
Yeah.
It's like
kangaroos,
snakes, and things like that. And then I think don't quote me on rule number 3, but N-acetylcysteine fixes everything, which is one of the jokes of toxicology. Benzos and N-acetylcysteine is most of our antidotes.
What about the black spider or the black widow?
The black widow doesn't usually kill you. It's mostly pain meds and anti-anxiolytics, so benzos. We do have an antivenom for it. It's hard to get. It's quite expensive and has a lot of side effects. And so I will use it on the very old or the very young when they're having secondary problems, like they're having a heart attack from all the pain, and they're just, they're very agitated, and the other meds aren't helping them. So that's when I'll potentially do that. But in general, it's supportive management. Here's your tox fellowship in about 30 seconds. Okay, supportive care.
Which means what to the listener and to the orthopedic surgeon?
Validating them.
Yeah, well, yes, you have to validate them. We don't give them Ancef. Okay, that's for our ortho. That's an ortho thing. Okay,
that is definitely
that's definitely an ortho thing. It's whatever they're dealing with. So if their blood pressure is low, support their blood pressure with medications, fluids, etc. If they need a breathing tube, you put a breathing tube in to help with their oxygenation. The body, Mother Nature's one smart broad. She can detox a lot of stuff, and we can support somebody through a toxin. Then sometimes they'll be okay. Sometimes they will not be okay or go back to normal, but we can support you through it because there is no antidote. So supportive care is the patient you see in front of you. Most emergency physicians can handle that bit of it. So the ER docs are good at the supportive management piece. So that's number 1 of toxicology. Number 2 is, try to decon the patient. So detoxify the patient if that exists. So decontaminate. So stop the exposure. And then if you can detoxify them, that's amazing if there is a real antidote. Benzos for agitation, anxiety, and half the time what we're using anyway. And then N-acetylcysteine, which is the antidote for Tylenol and good for your liver for pretty much everything else. Nice. That's the majority of Tox World, and that's the joke that we tell within ourselves.
Is Ativan benzo?
Yes.
It is. Good. Valium, Ativan, Xanax.
Oh, yeah.
Dr. Mike, I feel like we still are in an opioid crisis. Are we seeing a lot of opioids and fentanyl overdoses and...
Yeah, we do a lot of that in the emergency room, and as a toxicologist and addictionologist, opioid addiction is still a very big thing. And then fentanyl makes it particularly tricky because
it's really dangerous.
It's really dangerous. It's very potent. So you do not need a lot of it in order to get a clinical effect.
I have a crazy fentanyl story.
Oh.
So my mom and my sister came to Utah, Salt Lake City, to watch me when I recorded my dry bar. And we stayed at this hotel at the airport. And this stupid airport, we left, or I flew out and they were going to the mall for the day. And the airport, I guess, just gave out their room keys to random people.
Oh my gosh.
And then they came back at the end of the day. And it was this whole thing. They realized through the front desk that, the 10 other guys that have been here all day are not part of your party. And they went into the room and they had this really weird smell. So they called the police, and the police came and tested the room, and there was fentanyl. And they told my parent or my sister and my mom to throw away everything you don't absolutely need and wash everything else you have in hot, boiling, very warm water.
Because you thought they were going to overdose by touching the fentanyl?
The police were, because the room had tested positive for traces of fentanyl.
Okay.
Is that possible,
Is that
Dr. Mike?
possible?
Oh, this is one of my favorite things to debunk.
Okay.
Touching fentanyl is not going to give you an overdose. We have these very expensive fentanyl patches for a reason. It's a whole drug delivery technology.
Okay.
If it would be a whole lot easier if I could just do this and rub my fingers together and get toxic from fentanyl, it
so you
does not
can't.
happen.
Okay.
I've
So we
actually,
debunked the myth.
yeah, I've actually done that in front of cops before. They're like, "Oh my God, it's fentanyl!
Don't touch it.
Don't touch it."
Transdermal, you're gonna.
It's transdermal. It's like I gave myself Narcan. It's like if you're giving yourself Narcan, you did not need the Narcan. This
That's
is real.
crazy.
I've seen this before many times, unfortunately, because it's
Well,
misinformation. And
They should be more clear about that because I think about that a lot. Like I touch doorknobs like in seedy places
Mhm.
as a comedian.
oh, okay.
And I go, that one probably has fentanyl on it. I'm probably going to die.
No. Your skin barrier is pretty good about not absorbing the fentanyl.
What if you have a cut on your finger?
Probably be okay.
It'd still be
Yeah,
okay.
yeah, I
Really?
think you'd be fine.
All right.
Yeah, you're
What
not
if-
going to absorb them.
What if?
What
I like
if
the
you
scenarios.
snort it?
That can get you in
That
trouble.
would be a problem.
That can get you in trouble.
Okay.
Mucous membranes are a good way of absorbing things.
Okay.
My favorite ones are the Wellbutrin ones that they crush up their Wellbutrin and snort it and they come in seizing.
Oh.
Yeah.
Well,
Listener, don't do
Butrin's
that.
fun enough just taking it as directed. You don't
Yeah.
need to up it.
So Wellbutrin, if you look at its structure, and this is what we do as toxicologists, we look at the chemical structure of it. It has the same backbone as a cathinone. So KAT, KHAT. It's from the Middle East. And do you remember like the I'm the captain now from that movie? He's
Mhm.
chewing something. That's KAT that he is chewing.
Oh.
And so it's a synthetic cathinone, which was what Wellbutrin is. So it has a similar structure to methamphetamine. So that's why it's a stimulant. It's a stimulant,
Okay.
and your drug screen will
Listener,
be positive. Yeah.
It's a good one.
Don't snort it, and your standard urine drug screen will flag you for meth if you take Wellbutrin. And so that's a consult that I get. It's like the patient
Wow.
positive tested positive for meth, like they didn't use meth. That's their Wellbutrin. This is a hospital drug test, which are not great from a forensic perspective. And so I'll go, and this is something that I'll defend patients in the hospital so that they don't get the diagnosis of a substance use disorder. Right? I get a lot of these calls, and just to, the team will ask, why did they test positive for this? Like, well, that's all the Corsine they were taking, or that's all the Wellbutrin that they're taking.
Ah.
So that's a good medication history is important in my world.
So if you
Interesting.
have asthma, you
mhm.
could also get away with being a meth addict.
No,
Oh.
No, just the-
no, definitely not.
You have to be low key about it.
I wouldn't use meth ever.
Don't ever
Don't-
use
Yeah,
it.
don't
no, I'm
use
not saying
meth.
you should. I'm just saying it sounds like maybe you could.
I mean, asthmatics don't necessarily get that much benefit from meth.
Now,
No.
Wellbutrin.
No, right. What I'm saying is like they take Wellbutrin, right?
Not necessarily. No, Wellbutrin is for anxiety, depression.
For
Oh, I
your
totally-
mood.
Yeah.
For your mood.
Yeah.
I totally thought
And
we were
for
talking
smoking
about.
cessation. Sometimes,
Smoking
right?
cessation.
Used by Wellbutrin.
What's the one they
Naltrexone.
have in
Naltrexone.
inhalers?
So that's actually interesting that you bring that up. There is a brand of vapohaler that has traditionally had the enantiomer, which is because there's something called chirality here. So the left side and the right side of the same molecule. So it is L-methamphetamine. Good for you for knowing that. So it is actual methamphetamine.
Mm-hmm.
But it's the L, that's the enantiomer, and the way that we remember it is L for legal. So that'll be a defense that when I'm doing forensics work, they'll say, well, it was this version. And so then I have to get additional testing for the chirality. So if it comes back, I've never had a successful defense of this because I have to go after it. This is what they claim, and it just delays the inevitable. And then it all comes back in the D enantiomer. But yes, that is
And what is that used for?
Okay.
the vapohaler?
The L one, the
Oh,
legal one.
The legal one it's
For-
for allergies and
Oh, for
asthma.
allergies,
Yeah.
okay.
It's an inhaler. I'm not going to tell you the brand.
Okay. No, it's
I'll
not.
tell you the brand.
Does it have any of the similar effects
not
of
really.
the?
Not really.
Okay.
That's why it's safe to use, and that's why it's still relegated.
Isn't that amazing?
Yeah.
It's the same, but just the mirror image,
Yeah, it doesn't work as well.
left and right.
Yeah.
'Cause all it does is just doesn't it just like make your blood vessels bigger?
Yeah, it's a dilator. Good job.
Thanks.
Well done.
Wow. All right.
Call me Dr. Paula.
Dr. Paula. All right. Are we seeing any like horror stories from like kids on social media trying challenges and ingesting Tide Pods and don't do
Oh,
this,
that's
listener?
so good. That's
I
great
did a
question.
whole lecture for paramedics like a couple of years ago for our regional paramedics, and It was all about the challenges that people were
Yes,
doing.
tell us about
So-
the dangers of those.
Yeah, don't do the Tide Pod challenge. That can
People died.
Yeah, people can die from that because it breaks down surfactant, right? It's a detergent. It's gonna cause cellular damage and break down the membranes. And if you inhale it, the surfactant is what allows your lung to slide. And so if it doesn't allow that, then you
can't breathe.
You can't breathe. You can't exchange oxygen. So it's really bad, and it can cause burns. So if it's left on for too long, it can cause mouth burns or it can cause skin burns.
That was crazy.
Yeah. That's
wild.
real. There's the nutmeg challenge.
Okay.
Yes, that one was so bad.
It's not good. People will try
What
to
were people doing with nutmeg?
They're eating it.
Listener.
Don't do it. Interestingly, so there's myristicin, which is in nutmeg, and if you ingest enough of that, which I do not recommend because it'll kind of get you a little high. It's a little psychedelic.
Right.
All right,
Yeah,
all
do
you
this, listener.
bakers out there, get
Yeah.
crazy.
Yeah, with the
A
nutmeg.
little spice and seasoning's okay, but
yeah. Oh no, that's fine. Yeah.
Okay.
So Paracelsus, that's who we always quote, the original toxicologist. Like the dose makes the poison is what is what we shorten it down to. Everything is toxic. Everything is poison. It just depends on the dose. Even my jokes, they're toxic after too long.
Not even that big of a dose.
Not even-
honestly.
not-
Hey-o.
Shots fired.
shots fired. Leave the comedy up to the professional.
Listen, I'm not good enough to do stand up. I sit down.
Yeah.
He does sit-down comedy.
I am good enough to be an ER doctor.
Dr. Mike, tell us about like some accidental poisonings, like any interesting stories of how unintentional, accidental poisonings that the listener can kind of, any precautions we can take to avoid accidental.
Anything that at
Exposures
night we can think about and ruminate on and worry about for the rest of our lives.
So the most of my accidental poisonings are people using an over-the-counter medication
Okay.
outside the bounds of what's written on the label.
Read the
Right.
directions.
Read the directions. If
Listener.
it's not working for you, don't take more of it. Right? Because like I said, the dose makes the
Like
poison.
Tylenol.
Yeah, you can.
Is it 3 grams or 3,000 milligrams or 4?
We usually just keep it to 3,000 for most people.
3,000 milligrams a day, listener.
Yeah. And then keep an eye on things like if you take Tylenol and then you go take a cough medication that has multiple medicine, there's usually Tylenol in that. So that's where it gets you in trouble, is
Right.
because you're not paying attention to all of the sources of
Sources.
Tylenol, right? So you take Tylenol, you take your Percocet, you take your cough medicine, and
That person's gonna have a great night.
it could be their DXM, the dextromethorphan, robo-tripping. Oh, that's a fun one.
Robo tripping.
Oh, I had a kid one time that got brought in by their grandfather, and he's like, I can't feel my legs. And it's like, well, they're there. I talked to grandpa. I'm like, what happened? He's like, well, he was having a cough earlier, and I gave him some medicine. I'm like, did it have dextromethorphan? And he's like, here, let me show you. I'm like, you accidentally overdosed your grandson. So he'll be fine. It's just, that's what it was.
Wow.
Yeah. So
So the dextromethorphan can
get you very high.
and cause some neurologic symptoms.
Well, yeah, they're high.
They're
Wow.
just that high.
Just that high.
So it seems like the lesson to be learned is people need to do this more. Turn it around.
Yes.
Look at the active ingredient on the label and make sure that you're not taking a ton of medication with the
Use
same
as
active
directed.
ingredient.
Use as directed.
Yeah.
And if you have to take a picture with your phone, then zoom it in.
I can't.
Because I can't read those bottles.
Yeah, I can. Yeah,
Get a magnifying glass.
the exact formulation actually does matter because the certain brands will have different versions of what they have. This one contains Tylenol. This one contains Tylenol and aspirin. Right. So as an ER doctor, I need to know if you have if you fall and break, crack your skull and have a head bleed. I need to know if you're on aspirin or not because I got to do something about that. It's like, all I do is take Tylenol. It's like, actually, you take a Tylenol, aspirin. I'm like, oh, okay, that actually changes things for me.
Wow.
So.
So, I think of those medications where it's got 2 medicines in it as a fast food place that's like a Taco Bell and a KFC situation connected,
Salty.
where just one or the other. It's too complicated when you take all of them together.
It can be. It can be. Again, that's what I do as a toxicologist. So it's like they've taken a bit of this, a bit of this, a bit of this, and they took this yesterday. So how much of that is playing into today? And that's the fun part about my job is you get to play detective.
That is.
Now it's time for some common sense healthcare ads we wish existed. This episode of Dr. Ben and Friends is brought to you by the Forget Me Not helmet. Memory loss? Check out the Forget Me Not helmet. Wear a colander on your head with tinfoil. It blocks brain draining 5G waves and traps memories inside. And it protects from chemtrails. Recall everything or nothing. We're not sure. Conspiracy fans approved.
I love it. Would that be helpful, Dr. Mike? Tinfoil from any...
It won't give you aluminum toxicity, thank goodness. It's not actually made from tin, it's made from aluminum.
All right. Any other advice for a listener on preventing accidental or unintentional poisonings or toxicities? Or
if you're not sure, talk to your doctor. If
Yes.
hopefully your doctor is very professional and is writing you the appropriate dose. And just be careful with what you're
Child-proof
getting.
your house.
Childproof. Oh, please, don't let your kids get into the medicine. Tessalon pearls, they look like candy. So especially medicines that
That's
kind of
for
look like
coughing.
cancer. Yeah, it's for coughing. Yeah.
What happens if someone ingests too many?
Tessalon pearls are basically a local anesthetic.
Oh my God.
It's a local anesthetic.
Okay.
Toxicity is what it causes.
So what would happen?
That they'll have seizures and bad rhythms of their hearts. They're called cardiac dysrhythmias because it causes blockade of the sodium channel. So I've seen
So
some
it's a
really
common
bad-
remedy for coughing,
Yes,
but in excess, it can...
it can be very bad for a child. So one of my practice patterns is I always ask if I'm going to write it, are there young children in the house? And if there's young children in the house, I won't prescribe it, or I'll make sure that they lock it up.
Wow.
Yeah, because it looks like candy, and I've seen bad things happen to kids when they get into this.
Oh, they should not be making it look like candy.
It looks like candy.
Yeah, they should fix that.
No,
Right.
it's a pearl.
It's a pearl.
But it's again, when things are used appropriately, they're good. But it's when they're used inappropriately, and a child doesn't know any better necessarily.
Right. Well, it just feels like we fixed. That seems like a packaging issue. I feel like that could be fixed.
And so that is part of the things that we do in toxicology. So we advocate. That's why blister packs exist, right? Because
Keep kids from...
it makes it a little harder and it keeps things more organized. So not just kids, but our older population who may have some memory issues. They may say, "Did I take my medicine today?"
the
Right?
blister pack.
The blister pack will help with that because they might accidentally take an extra dose of their medicine. Okay, so
Now, to a little role reversal, do you have any questions for a couple of professional comedians or a professional comedian? I know.
yes. So I'm not, like I said, I'm not good enough to do stand up. It's like, how do you find, like, what's your inspiration? How do you get new material?
Oh, good question. Paula? Miss Paula?
Well, I like to go outside and do stuff, get out of my house, and hang out with friends. And then you talk about stuff that's happened to you, and you riff off each other, and then you start laughing, and you think, I should write that down. And
That's a funny premise, or that...
yeah, my comedy, if you watch it, it's not highbrow in terms of like the topics are not crazy. It's not like I'm like thinking about stuff. It's just random stuff that happens, or like you make a lot of jokes about your family and or your friends, or just you do dumb stuff and then you make jokes about that.
Got it. Yeah.
So, yeah, it's caused me to be a lot more observant to try to look for...
Yeah, that's a great word for
It's
it.
like you just kind of go through your day and not notice things, but then when you're a comedian, you're like, oh, there could be some material in that, or you're kind of on the lookout for some material.
If you hang out with a comedian, they'll make comments about everything. And it can be really funny, and it can also be extremely annoying. When you're like, you just make comments off everything, what something looks like, what you think it is, and you just kind of like, you just very observant, I guess. Yeah.
That makes sense. I've seen some of his stuff, and it's like the Garmin. I'm like, oh yeah, that's true.
Some observational comedy. It's definitely. And then I get a lot of like emails with like crazy, and this will be a segment of our show, crazy medical headlines. So sometimes I tell about some crazy medical headlines and riff on those, but observational and...
Because I'm always struggling to come up. There's a nurse over at one of the hospitals. She's like, all right, hit me with your latest one. I'm like, I was just here yesterday. I didn't come up with anything new.
He comes up with some good one-liners.
That's awesome.
But they're all medical. And that's my concern with my little jokes is that they're very specific. Right?
No, that's good.
I mean, but they're for a specific audience. They may not get it. It's mine. I'm not general. My fear is that I'm not general enough.
So here's my opinion. The more niche you are, the better, because this is maybe more social media, but I think it's true where it's like, general is mildly interesting to everybody, but you're not going to get anywhere being mildly interesting. So you want to be super interesting to a select group of people, and then you'll get this really intense like group of people that really like your stuff. And then, I mean, I don't know if you do this, but you'll like end up watching, like I remember watching like 3 hours of videos on cave diving. That's a pretty niche topic, and I don't cave dive. But when you see a group of people get into something, and like even just now listening to you guys talk, you're like, but this is a world I don't know about. And so it's,
You want to learn more about
yeah, you get people who know about it and can stay on pace, and you get people who don't know about it, but they're really interested because clearly what you're talking about is interesting. And so I think you actually should be more like as niche as possible.
Got it. I told him my Auschwitz slaughter joke, and that like slays with the orthopedist, and nobody else knows what it is.
Yeah, but I'll Google that afterwards.
listener. What did you learn about cave diving?
Oh, well, I learned don't do it.
It sounds dangerous.
Step one. No, I learned that you can get toxicity. So you have to have a certain amount of nitrous in your oxygen if you're going to go down to a specific depth.
Yeah.
But you have these dumb boys who like think that they can go farther than they can, or they don't follow the rules. And so what you do is you can get so far that you can get nitrous I don't know if it's poisoning or if it'd be, I mean, I guess it's poisoning, but it's like you get drunk basically.
Nitrogen narcosis.
Narcosis, there you go. And so then you get turned around and you'll see people who will, because they're all over the place, they'll just swim all the way down.
Disoriented, thinking
very
they're
disoriented. And so that's, but you need it to go down to that depth, and it's just a really tricky game.
Yeah. And then not only is the nitrogen being absorbed, it's if you don't have a safety stop coming up, if you got on too high of a depth, the bubbles will come out of your blood, and that's how you can get an air embolism.
The bends.
Yeah, you get the bends.
Caissons.
Yeah.
It's bad. It can be very
Be careful
scary.
coming
Yes.
back up.
Yeah, you got to
Sea divers.
take your safety stop.
I remember learning that on House when the guy was like diving, and then the next day he was in the plane and
Yep,
he got
can't do
super
that.
sick.
Yep, can't do that.
Yeah. Air embolisms, I just have to say, I had an IV and I thought the little things of air would do that. And I remember like that it said like on the machine, like air in line. And I was like
Freaking out.
1 second away from ripping that out. I was like, they're going to try and get me. And then the nurse had to like explain to me that that's not a big enough air.
Right. Yeah.
Yeah.
Though you're saying between the toes, I'm like, not enough.
Yeah. But I thought it could be like a this much of a syringe. Is that enough?
Depends on the thickness of the syringe.
That.
And where it's going,
Yeah,
like
where it's
in between
going.
toes and
Yeah.
just under the skin, probably, but
No.
injected into a vein,
Oh.
a bunch of air.
Yeah.
I wonder
Could
if
be.
it's like, you know, when you have like dough and you bubbles, and if you kind of like shake it, it kind of gets the bubbles out. It's like maybe if you get it put in your toe, then you just shake them. It kind of shakes it out.
I'm not sure if it works that way, but
It works that way.
But has anybody tried? I'm just kidding.
but if you see people flicking the syringe,
Oh yeah,
they're
you're
trying to
Yeah.
get
get
the
the
air
air
out.
out. Yeah, we try to get
Oh
the
yeah,
air out.
see that.
classic doctor move.
Classic
Exactly.
doctor move.
It's
They
like nurses
teach us
say-
that in
Exactly.
medical school.
Yeah, exactly. You just gotta make it look good. It's like, well,
Yeah, and then
You
squirt
ready?
some into the
Yeah.
air.
exactly.
Yeah.
Johnny and Roy from Emergency, you pop the two ends off and you squirt it back in.
When they do the like, take the cap off with their mouth.
Oh yeah, yeah. You got to make it's all the it's
For
the,
effect.
the drama,
Yeah.
the drama.
The drama.
I will run code sometimes.
Yeah, tell us what that means, running a code.
Running a code is a resuscitation. A code usually means the person is
Stop breathing, your heart stop beating.
exactly. So it's CPR and you know, putting a breathing tube in and giving a lot of medications.
Epi.
So it's closed loop communication, right? It's the same thing that happens in a lot of industries.
Mhm.
So you know, sometimes I will we'll do it like Gordon Ramsay.
Okay,
and
tell us more about that.
So we'll do it. It's like okay, I need one of epi, like one of epi heard chef, and so one of
Yeah, that makes sense because you have to have that
Mhm.
like down really well. You
Mhm.
can't. It has to be like, yeah, that makes sense.
yeah, and so it's the same skill set. And instead of saying doc, they say chef.
But those codes, we see those a lot on medical dramas, but
Oh yeah, yeah.
those are pretty accurate. Someone's on the chest pumping their
The
heart.
compressions are always bad.
Yeah. Oh yeah. On TV
Sticking
shows,
out.
they're bad. Yeah. But we have ways of monitoring them with the system, and there's usually an observer that's giving feedback to the compressor if we're not using a machine compressor. Code should be quiet. A good code is quiet because everybody
Not
is
mayhem
calm.
like on TV.
Yeah, no, you don't want that. That's not a good code because nobody knows what's happening, and then the team leader can't organize their thoughts, and then so this way you can take things, in more information that you're given from your team in order to make the next decision and hear when the next time a medication is being given by, or need to be given by your scribe because they're your timer, because things are all protocolized. And then there's other things that are reversible causes. So sometimes I'll do an ultrasound and take a look at the heart to make sure there's no fluid around it. Or sometimes I'll take a look at the heart to see if it actually is beating, and I can call the code. So there's multiple reasons for doing ultrasounds in a resuscitation.
Listener, everyone should get CPR certified.
Yes.
Don't learn your CPR from medical dramas because I don't think they're doing chest compressions right there.
No.
I don't understand how they can't do it right. It's probably one of the easier parts to get right because it's like, I think like a 13-year-old babysitter kind of knows how to do chest compressions because you got to get CPR certified. So how do you know how you can't just get that right? It's so confusing to me.
People are afraid to break ribs.
Don't be afraid to break
But when
in
you're
a life
acting, like they don't get the
death
rhythm
situation.
right. Like at least get the rhythm right, you know?
and in a force.
Yeah.
Yep. It's about going hard, going fast. Just get them.
Do you remember the first time you ever were like, oh, I'm leading a code for the first time?
Yes. So I was 17 or 18 years old. And
Really?
Yeah. I was an EMT, right? So I was working at an event venue doing the EMS for the venue. And it was a sponsored boxing match. And end of the night, okay, everybody needs to go home. Like there's a lot of people passed out drunk. It's like, come on. Like, okay, they get up. This guy's like, all right, come on, not getting up. Like, all right, rolled him over. Stabbed.
Wow.
Just like blood coming from his chest. And we're like, what do we do? Oh, CPR.
Oh my gosh, that's crazy.
I was 18
You were like
years old.
18.
Wow.
I was 18 years old, like, live. The paramedics show up because I was an EMT basic at the time. The paramedics were like, dum, just put the breathing tube in. Hey, medical center, we're coming in with this. Meanwhile, I'm like, don't die on me. Don't die on me. The amount of experience difference was insane.
That's
Wow.
Just looking back on it, it's just like looking at myself when I was 18 years old versus me now. I'm like, you're an idiot.
I think we can all think that.
I love it. All right, folks, big thanks for tuning in to the Dr. Ben and Friends podcast from the heart of Nashville. We're celebrating healthcare heroes like Dr. Mike and professional comics like Honorary Dr. Paula. Remember, we can be serious in surgery, but some of us are seriously funny. All right, if you love today's episode celebrating comics and healthcare heroes, join Team Dr. Ben and hit that subscribe button. Your word of mouth is our best support. Tell a friend, your nurse, your doctor. We'd love to hear from you and your friends. Drop your favorite dad joke or general questions at drbenandfriends.com. We can't wait to feature you in our next episode. All right, Miss Paula, let's see. How can our listener find you?
Thank you for asking, Dr. Ben. This is how you can find me. You can find me at my address, but I will not be giving that out. You can also find me, follow me on Instagram. Do it. Follow me on Instagram at Paula Comedy. Follow me on TikTok at Paula Pocket. I actually don't remember my TikTok, so you don't have to worry about that. But
Just
Instagram. And look me up on YouTube. Paula Kosienski. It's linked on my Instagram. Just go to my Instagram. Freaking, you better go to my Instagram.
At Paula Comedy.
Paula Comedy.
The Paula, the only Paula in comedy, probably.
Paula Poundstone.
She's funny.
All right, I love it. And Dr. Mike, our healthcare rock star, anything for our listeners? Do you want patients to find you?
If you're going to find me, you're usually going to find me in the emergency department.
Right.
So hopefully you do not need to ever find me for any one of my specialties. But if you do, I will try to make you laugh if you're not trying to die on me.
And are you on any social media that you...
Yeah, actually.
share?
So Instagram, TikTok, YouTube at ToxDocs, ToxDocx.
ToxDoc. I like it. The TikTok ToxDoc.
All
right.
You can see him on Zocta.
All right, I'm grateful for you both. Thank you. Serious saves from the ER Pro, hilarious detox from our comic pro. Together, you two are an antidote, just what we needed. We will see you next week, listener, when I, Dr. Ben, and my
friends.
Help you put more med in comedy. See you next week. Take care.